Hi, it's Andrea here from Proactive Pelvic Health Center, and today I'm going to talk about perineal scars, what they're all about, how we treat them, and when to see a physiotherapist. So perineal scars can happen if you've had a tear or an injury or even an incision in the perineum, which is the area, the muscular kind of tissue area that lies between the vagina in women and the anus. In men also have that area just behind the scrotum, between the scrotum and the anus. But in women, it can be vulnerable to injury during childbirth, and any tissue that becomes injured in order to heal forms a scar. So it's the scar tissue that can become problematic because scar tissue is generally more inflexible and more sensitive than normal tissue. And the healing process for scars involves adding pressure and movement and stretch. And the vaginal area doesn't often get those kind of stresses and stretches unless you're very active or sexually active. The problem, of course, people don't necessarily want to be sexually active if there's pain or tightness in the area. So then we kind of run into that vicious circle where you're in pain, you're avoiding sex, you get tighter, you become more sensitive, you experience more pain, and you avoid sex more. So it becomes like a vicious cycle. And having a therapist with skilled hands to apply gentle, graded pressures, stretches, can be really helpful in desensitizing the area, helping it to become more flexible and less painful. Can really help to bridge that gap and help you resume sex with more comfort, less pain. Stretching can also be done on your own. There are tools, or I call them tools that you can use to stretch the area, and a physiotherapist can show you also how to use those tools safely and effectively. So that's a bit about perineal tears, perineal scars, and how we treat them in physiotherapy.